This next section is going to be about the specific strategies of increasing physical activity. And some of them are going to be familiar to you, but others might not be quite as clear. So I'm going to talk about the ones that are discussed in your guidelines book, the 11th edition. How important is it for self-efficacy for a person to be able to take charge of their own program and monitor themselves? And that's sort of a question that's obvious. It's going to be real important. To get a person to feel like they can do it, they know they can do it, they need to take charge of how they record their exercise, what they do, how they do it, are they tracking themselves toward a goal, and also identifying what sort of things are getting in the way of them being able to exercise. Remember that the most effective component of self-monitoring, or the most important component of self-monitoring, is that it's important to do when you have other strategies as well. The strategies for self-efficacy are listed in table 12.2, and you can look at those for each one, and you can see that watching people, the vicarious experiences, getting physiological feedback. The strategies for each one are not all encompassing, but they give you a really nice example of what sort of steps you can use when you're working with a client. So communicate the meaning of symptoms associated with a behavior change. The person, for instance, when somebody knows they might have a little leg soreness, that when they do have leg soreness, they're not going to worry like, oh, this was too much, this was too much. So it's really important to take a look at these and get an idea about what kind of examples are going to be helpful. Having a SMART goal is really important. And remember the components of a SMART goal. It doesn't mean that you have only one, that you have 5 separate goals related to a behavior. It means that you have a goal that contains those components. So it has to be specific, measurable, or trackable, challenging, potentially realistic, and also needs to have a deadline, and it needs to be something that they determine for themselves. Implementation intentions, I think, is really helpful. These might enhance the link between exercise intentions and behavior. So when you know if a person has intentions of where they'll exercise, when they'll do it, if they'll do it with someone, that really helps to enhance the likelihood that a person will do that behavior. So the goal is, and I think I've mentioned it before, how confident are you that you will do fill in the blank and have the person respond? If they don't feel confident that they will, they don't have the intention of doing it, we need to think a little bit more clearly about getting some goals that the person is willing to do and has identified that they can do. Reinforcement is going to be important, especially when an individual is initiating physical activity. They should be encouraged to get a reward or to reward themselves for meeting behavioral goals. We're not talking outcome goals, we're talking behavioral goals. So the going for a walk is a behavior, it's a choice. Losing weight is an outcome, right? So it's important to have the behavioral goals, rewards for that. If you have an environment that improves that intrinsic motivation, it's going to be reinforcing for the individual. So feedback, positive feedback, great job, knowing that it's difficult, letting them know that a person's having challenges, and also giving them that ability to make their own selection, really important. How important is social support? I'm going to tell you, really important, especially for older individuals, older women who may not have had any kind of experience exercising, or individuals that have a chronic disease or disability. Social support can be a huge motivator, and providing that in the form of guidance is often what you will do when working with individuals. But here's some examples. An instructor, family, people you work out with, neighbors, other health professionals. Those can all provide social support. Another strategy that's going to be key is problem solving. And problem solving involves knowing what kind of barriers are getting in the way for a person to become physically active, to brainstorm with that with your client. Also, don't just say, here's what you do, but you can brainstorm some ideas. And what the person comes up with is often what is going to work. And sometimes you got to go back and say, well, how did that work? And revise it as necessary. So the person or your client should come up with those solutions or determine that have those solutions at the ready, and you can be supportive of it, provide social support, but it's really important that the person has some autonomy for that, for the specifics. Affect regulation is the ability of a person to kind of adapt to their emotional state in order to exercise. And so if you look at it in terms of the emotional side, I don't wanna, I don't like it, it's no fun. What we do know is that enjoyable exercise is more likely to be done than exercise that is not enjoyed. So identifying things that the person likes to do is going to establish or develop or build intrinsic motivation so they look forward to it. It might be helpful to kind of get a sense of how did you like that? How did you feel? How did you feel afterwards? And evaluate that in part of your recordings of your activity. You know, did you like that activity? What did you like or what did you not like? And this goes in the sense of what people like most. And I'll remind you again, people often, especially people starting to exercise, are going to pick that moderate zone, even though you might have identified a target heart rate zone. They might pick moderate exercise over others. To get that positive effect, exercising in a good context with friends or something, a place that's really pleasing, whether it be a hike, um, a park, whatever, a location that that person enjoys. Having a lot of variety tends to improve that positive effect or the positive emotions. And a reward system for exercise does increase or improve the emotional control. Table 12.5 has a list of barriers, a list of theories is that they are associated with being effective to work with, and then some strategies that could be utilized. So for instance, if someone has a barrier, it's just too expensive, then you can look at potential lower cost or free options that are possible for that individual. So barriers are, again, we're going to look at working with our client to come up with what their solution is going to be, but we might need to give them some help. And this is a pretty big table, so I just put it as 2 potential blocks. But I think this particular table is pretty darn helpful. How do you stop somebody or decrease somebody from relapsing? Well, sometimes relapsing occurs because of an illness, because of an unplanned family emergency, because of a pandemic, right? So um, relapses are often not expected, but sometimes we have a list of things that might be potentially an issue, and it helps to have a plan in place or help the individual get a plan in place of what to do if there is going to be a circumstance where it's going to be a chance that they might not be able to participate. So having that plan, it can be used in all behavioral approaches, and one of the things that can help with a person not relapsing is to have frequent goal adaptations as well as variety, and to encourage that all or nothing thinking, discourage the all or nothing thinking. If you miss one session, it's not an end, it's just a day. And so we can always start up and go forward and start again the next day. Other strategies could include counseling, and brief counseling and motivational interviewing is specifically listed. Brief counseling can be on any of the theories that have been discussed. That could be one specific type of brief counseling is motivational interviewing, and it has a different function. The main thing with motivational interviewing is it requires a lot of questions. It requires good listening skills, and it involves asking questions about what a person's thoughts are and what's holding them back, and to help them to change the way that they view things. So table 12.6 has a number of questions, and I think it's kind of nice. Ask questions that are related to why they should change, how do they feel about it, do they intend, those are evocative questions. Do they think it's important? Ask them, how confident are you? Pros and cons, elaborate. And so the motivational interview is asking questions and being very empathetic as you listen and not judgmental. And I think the values and goals point to that. What in life is most important to you? And how does physical activity or inactivity matter to this? Many times if you work with clients that have grandkids or kids, they'll say, oh, my kids are so important to me. And well, how does being physically active make it, how does that influence or matter to your ability to being active with your grandkids? So that can help with exploring what kind of values and goals that they have, and help them to come up with a goal that's going to be specific for what they want out of their exercise program. The stage of change counseling, that has to do with the trans-theoretical model. And there are a number of interventions that work, like those 10 interventions that I mentioned in the previous slide or the previous presentation. And box 12.2 has a really nice list of example strategies that you can use. Leadership skills are part of the story as well. And when an instructor creates in group exercise, when an instructor creates an environment that is positive, is dynamic, has goals, and really gets people excited, that's been shown to be better than kind of a boring thing. And there are just some examples down here. If you are a socially supportive leader you are going to help with people feeling less embarrassed, more likely to come to the next class, say they have a lot of energy and really enjoy your exercise class. These are the 5 principles to improve cohesion. And what is your group name? Give people responsibilities and roles, which is really interesting when people come in and you, if you're teaching a group exercise class and you ask a few people to go get some equipment and to set it around for folks, asking people to maybe partner up with someone and give them a, to demonstrate with another person. It's kind of fun. Um, Individuals in the group may have to give up something for the greater good of the group, sacrifice. Showing difference level of intensities is really good, and sometimes if it's a beginner class, you teach to the beginners. You can give the other folks a little bit more challenge, but that's something that we have to think about, is that there's something with a greater good. And the more interactions by using people's names, I am going to tell you that when you use people's names, it builds connections and it makes a difference. When we're working with our clients, we want to be competent, culturally competent, and recognize what the beliefs, values, and practices of a population is, and to understand what kind of limitations might be in place. So, for instance, in a water exercise class, if you have women in your class that are Muslim, they might be uncomfortable exercising with men. So having, and also there are certain swimsuits that are much more covering than what a typical American would wear. It's important to recognize there are those constraints and cultural beliefs, and one of the things that we do in our in our water classes is to, if we have someone, we talk to individuals and give them an idea about, here's what you can, here's a place where you can get an appropriate bathing suit that you will feel comfortable in. So understanding your individual and your population is really important. Likewise, it's important to consider if somebody is transitioning. We don't talk about that much in our program, but it's important to recognize that we might have individuals that are trans, or in the process of transitioning. Individuals might prefer to be have a different pronoun. It's important to not take someone and think that they speak for the entire population, right? So what's it like to go from this to change your gender or to change your sex? It's not okay to do that. And if you don't feel comfortable, it's your responsibility to talk about it or to do some research on it. And I know at the university we have a resource for that, and most institutions will. Working with older adults is going to be more and more common because we're getting more and more elderly that are more active, and are more people that are getting older. And many times those individuals don't have a good social support. In fact, their social support might be, oh, just, take it easy, I'll do it for you, which can be an implicit message that you're too old or frail to do these things. And they might not, they might need well, they'll probably need some encouragement, and also to understand what the risks and benefits of participating in their activity is. And so it's important to think about barriers and also to be a good social support. So for an older adult, largest barrier is fear. fear of falling, fear of pain, fear of discomfort, fear of my condition worsening, fear, or no knowledge of. Or they had knowledge when they were in the Marines, and that's a different set of exercise. So you'll get older individuals that'll want to do straight leg sit-ups or leg lifts, and it's not appropriate. So we have to be mindful of that, right? And so keeping that in mind, exercises that are enjoyable, and also be aware of the conditions that might be present and how to consider those conditions. Conditions being back pain, heart disease, diabetes, etc. Mental illness is a potential challenge, and individuals often will have medications or fear, discomfort, might not have resources, and it's important to recognize that individuals that do have mental illness, especially when we talk about depression, anxiety, that exercise does have a positive impact, reduces state anxiety, and that would be a fear of something specific, a specific situation. Trait anxiety is almost a personal tendency to present state anxiety or a personality trait of being anxious in a lot of situations. Exercise is going to help with that, decrease depression symptoms, also is beneficial for schizophrenia and ADHD. So that's a positive side, but they might be a little apprehensive. And again, fun, realistic goals, and to think about what's going to be help with energy or motivation. And with motivation, if you like it and you self-pick it, you're going to be more likely to do it. For kids, we have to start to think about what is the motivation. If it's an external motivation or extrinsic motivation, if their parents or their doctor is saying it, they might really have uh, uh, tangible forms of social support like transportation and fees. We want to develop intrinsic motivation for kids, and that is by developing increasing self-efficacy, behavioral control, and a sense of autonomy. When kids really take charge and feel like they are doing things they like, that they have some say in, that really helps for adherence. And families and schools can help with autonomy, and we've done much better with that, but we do need to be aware of, kids need to have some say. And when they have some say, they are more likely to participate. Individuals with chronic diseases and health conditions, we can encourage, develop self-efficacy, and really help them to believe that what they can do is going to be possible. And once they believe they can do it, they are going to have barriers that could be associated with their back pain, their arthritis, their mobility, their fatigue, their limitations with being in a wheelchair, right? So there are going to be, first is that self-efficacy component. Individuals with chronic disease, they, let's see here, what do we want to say? I guess the only thing I want to say is that we need to make sure that we include diseases, or we include exercise that is going to also focus on improving or controlling the disease or condition. So it's what we like, but we also want to include activities that have a purpose to improve the disease.